there, my name is Dr. Hanson and with Hanson Chiropractic and Injury, and our health tip of the day, today we're going to be talking about the hip area and a very common issue that we deal with a lot in chiropractic, which is the sacroiliac joint. The sacroiliac joint is made up of the portion of the low back between the sacrum and the ilium. It's one of the most common areas of dysfunction that we work a lot with, and one of the primary issues that comes along with this is tightness in the hips. And so I'm going to give you 3 stretches today that really help to improve the mobility of the hip. When we study kinematics, which is how motion moves through the body, we want to focus on mobility in the ankles, stability in the knees, and we want mobility in the hips, and we want stability in the lower back. That's kind of the sequence that we look at as physicians. So today I'm going to focus on improving the mobility of the hips. I'm going to give 3 stretches. I have my model here, Tina. Tina works in our office, and so she's graciously allowed us to be able to do this for her. So the first stretch is going to be the piriformis, and the piriformis muscle hooks from the tailbone or the sacrum over to the hip area. So if you want to have a seat here, and what she's going to do is she's going to cross her right leg over her left. She's going to put the ankle on the hip. And this is best done where your knee and your hip are basically in line. So you want to be kind of at that height level. You can do this in most chairs, and you want to have the hip and the knee in line. You're going to take your sternum or your chest, and you're going to keep your chest up nice and high, and you're going to bend straight towards the bent knee. So she's going to be slightly going about a 45-degree angle, and she's going to be going towards that, keeping the chest up and high, not really rounding the back. You want to keep the back nice and straight. That'll put more stretch on the piriformis. When you do this, you should feel a good stretch, in this case on the right side, and it should be right across the glute area. You'll feel it in the hip, right in the glute area on the right side. You want to hold that stretch for 30 seconds. So I do a nice slow count of 30 seconds, breathing through it. Think of it like yoga. You want to be breathing, relaxing. These are really big, well-used muscles that take a lot of work to kind of unravel. So, stretching it for 10 seconds is just really not going to make much of a difference. At least 30 seconds. Frankly, if you did it for a full minute, that's even better. We'll go ahead and switch sides. And so now you'll take your left leg over your right. And again, same thing. Right knee or left knee comes down. Sternum come towards the knee. And again, you're going to hold that for a nice 30 seconds, okay? Breathing throughout. So that's the first stretch for the piriformis. The second stretch is going to be for the gluteus. And we're going to go ahead and lay on your back here. And this one's a little bit trickier, but really one of the most important ones to stretch. I think this is probably the one that gets missed the most. You're going to basically make your legs into a figure 4. So we're going to take the left leg, we're going to cross it over the right. And now we're going to bend the right leg, and so that creates an opening, and you're going to reach through that opening with both hands, and you're going to grab the right leg. Okay, so you can see that here, and you can interlace your fingers if you're able to. That gives you a little bit more grip, and you want to take then and pull that right leg towards your chest. Now some of you, when you do this, boy, you'll barely be able to get just to even the point where you're laying even. Just breathe through that. You'll feel a good stretch. In this case, that's going to be on your left side is where you're going to feel that for this current configuration. So you'll take a nice deep breath. You'll breathe through that again. 30 seconds, really 1 minute is what we want. And you're going to be stretching that, in this case, the left side. We'll go ahead and come down. And then we're going to do just the opposite. So now we're going to cross the right leg over the left. We're now going to bring the left leg up. That creates this opening. We're going to reach through. Oh, the other way? Yeah, that's perfect. That's what a lot of people do. So you're going to reach through that opening. You're going to grab the front of the left knee, and you're going to take that and you're going to pull towards that left knee. Now, some of you, if you're not able to reach here, you can take a washcloth or a cloth, and you can just put it across the front of the knee, grab the 2 ends. That gives you a little bit more room to work with. And so you can start gradually kind of creeping up until you're able to pull or get a hold of the front part of the knee. You can also use a band. If you have a band at home, that gives a little bit more slack, a little bit more give to it, but it's best to have something firm, okay? You're going to do this stretch again, 30 to 60 seconds. You're going to feel this, in this case, on the right side of the glute. boy, that's going to really free up the hip. That is one of the most common areas. It gets really tight, especially with everybody. We're sitting, we're generally less active right now. Sitting home, lots of computer work, boy, those glutes get really, really tight. You'll be amazed at how much that'll free up the low back. Okay, and then the last one, we're going to go ahead and come on up here. The last one is we're going to do the psoas. The psoas is a really strong muscle that goes along the front of the spine, actually connects to the front of the lumbar spine, goes down through the pelvis, connects to the femur, basically the anterior medial portion or front middle portion of the femur. It's one of the main hip flexors that basically lifts your leg this way. It basically pulls the leg up. Again, very, very tight when we do a lot of sitting type postures. And that's what a lot of us are doing right now. This is, if I was to do one stretch and have this be the one that you do each day, it would be this next stretch that I'm going to show you for the psoas. What you'll do is best to take a chair, put it up against a wall or facing towards a wall, and let me show you how to get this set up. So for Tina, she's going to take her right leg, she's going to put the foot on the top of the chair, the knee is going to be down on the belly of the chair, her left foot is going to be out in front, and so we want to have this knee out in front. We don't want the knee going past the ankle, so we don't want it back here and we're going like this. We really want to stretch forward and we want to sink down, okay? So I'm going to have her think of sinking down, and as she sinks down, notice how she's keeping her chest high, so she's not going here and then bending forward like this. I want to sink down like this. And when you do, you should feel a stretch right where you put your hand in your pocket. It's going to be right on the front part of the leg. Again, this is a very, very tough, thick, strong muscle. 30 seconds to 60 seconds really is what I encourage. A full 60-second stretch to this. Nice breathing. And as you breathe out, you kind of let yourself sink down a little bit more. You'll kind of lengthen and untether that muscle. Okay? You go ahead and stand up here, and then you would, of course, switch sides. And we do the same thing on the other side, stepping that right leg forward, and that's how we'd open that up, okay? Okay, you go ahead and come on up here. So I hope that helps you. Those are 3 excellent stretches, and the hips are really one of the most important areas of the body to stretch, and one of the ones that are the most overlooked, especially now when we're sitting more and we're not doing as much. It's really important. So I hope you find that helpful. Please, if you do, go like us on Facebook. You can go to our YouTube channel and subscribe. And please, you can see our emails are below. If you have any questions, anything we can do to help you, then feel free to send us an email, or you can make comments on our Facebook page. We appreciate that. We look forward to serving you, and we'll have another hip health tip of the day for you tomorrow. Have a wonderful day.